Awesome. So again, thank you all so much for being with us today. I'm just going to go over a few welcome and housekeeping items before we get started. All this will be recorded, and our recording, slides, and materials will be available after the event. We'll also send them, we'll be sending them out to people who attended. So if you're here or if you even registered, we'll make sure that you get those materials. Everybody is muted. We will have a Q&A portion at the end where we will ask folks to unmute themselves and ask questions, or folks can drop their questions in the chat and we'll read them out to our speakers to answer. And then lastly, we do have closed caption available for folks. So if you see at the bottom settings bar, where you have a lot of options, you can click the CC live transcript and that will turn that setting on for you, so you can use that. But again, thank you so much for being here with us, and I'm going to hand it over to Kiran Satar-Sangwan to talk about recording.
Great, thanks so much, Monica. As Monica said, I'm Kiran. I'm the executive director here at CPEN. Have the privilege of working with our amazing staff team as well as our community partners. And my pronouns are she, her, and hers. And I'm coming to you today from unceded Patwin land in Davis, California. And really thrilled to see so many folks joining, lots of familiar faces, but also lots of new faces too. And so we're very excited at CPEN to get to know all of you and to think together about how do we really build community power and how do we advance health and racial equity. So next slide, please. Great. So I want to first give you a little bit of context for this webinar and for the work that we've been doing here at CPEN. And we have fondly named this body of work People Power for Public Health, because for us at CPEN, equity is fundamentally about power, and it's about who has power and who doesn't have power, and how do we really transform that so that our communities who are most impacted by policy decisions really are able to influence and to make those decisions at the state level, at the local level, at the neighborhood level, really shifting that balance of power. And so that's how really sort of the lens we bring to this entire body of work is really understanding that there's a big gap between what communities want and need in our local communities and what is available to us. And so this project really aims to take a deep look at our local communities and what are our needs, our priorities, our desires as communities of color in our local communities, understanding that California has 58 different counties and that there's a lot of opportunity to change how things work at the county level in California because of how so many things are structured and work. And I think this also comes at a time when there's increasing attention to how we think about the money that counties have and where that money goes and who decides where that money goes, right? Back to the concept of building community power. And I think understanding that many of us share that counties historically have not prioritized health and social services and addressing social drivers of health, but really have invested very heavily in the carceral system. And so, you know, we really want to thank and appreciate and acknowledge all of those folks who have been doing this really hard work on thinking about county budgets and thinking about abolition and thinking about how we make change. And as CPEN, what we're hoping to understand and to work with all of you on is how do we bring public health and health into this equation, and what is the contribution that we can make here to change things for the better in our communities. And we sort of base this project on the theory of change, that our communities know exactly what they need to live in thriving and healthy neighborhoods, and that we deserve the power to make those decisions, those funding decisions, those program decisions, those policy decisions, etc. So next slide, please. And so we are going to sort of structure this webinar, as well as this is how we structured the work, around basically 3 questions. And one is really taking a desire-based framework approach to this, which is really, what do we want? right? Focusing less on deficits and trying to focus more on our desires, our hopes for the future. And you can read more about that framework in our full report. But really the first question is, what do we want, right? What do we need? What are our priorities? What do we believe would help us to live in healthy communities? The second question is really looking at what the decisions that counties have been making, which is really the question of what do we get, right? And I'm sure no surprise to you, those things are not aligned right now. What do we want and what do we get? And so then the third question is, how do we change that equation, right? How do we align what we want with what we get? Or what we get with what we want. And that really is about building community power. And we're so thrilled a little later in the webinar to have a guest speaker who's really been doing this at the county level. But before we get to that, I'm gonna go to the next slide, please. And I'm going to turn it over to my colleague from CPEN, Wei-Yu Zheng, who's our Associate Policy Director and really leads our public health work. And she's just going to talk a little bit more about the methodology, the sort of how did we do the work that we did for this project. Wei-Yu?
Thank you so much, Karen. Hi, everybody. Good morning. I'm Wei-Yu. So very briefly on the methodologies, I know that the slide, the text is a little small, but don't worry, you can read about this in our full report. The information is there, and you'll have a copy of the slides after the webinar as well. But overall, you know, our People Power for Public Health project utilized a 3-part research design, including a statewide survey, multiple county-specific listening sessions, as well as community leader interviews. And so I wanted to go over each of these methods a little bit, just so you understand, you know, what our study really focused on, who we collected the data from. And so in terms of the statewide survey, so we utilized the online platform to do a survey, and we did the survey actually in multiple languages, including English, Spanish, traditional Chinese, Korean, Tagalog, and Vietnamese. And so we were able to collect individual responses from over 900 individuals, and really focusing on, you know, communities of colors, you know, lived experiences. Next, we did county-specific listening sessions in 5 of the counties in California. So these counties are Sacramento, Fresno, Kern, San Diego, and Orange. And so, you know, these 5 county listening sessions that focused on populations that really are the most disadvantaged and marginalized, including folks that are experiencing housing insecurity, currently incarcerated populations, Black, Latinx, immigrants, Asian Pacific Islanders, and Native American residents, as well as community health workers. And so the county-specific listening sessions, we involved over 400 residents and really heard about, you know, their feedback on their experience in their counties. And finally, we also hosted key informant interviews with community leaders, including many of you that are actually on the webinar today, as well as our speaker later from Contra Costa County. And so collectively, these methods gave us really insight on how and why we should be transforming local budgets that focuses on communities' desires and wants. Next slide, please. Also wanted to give a specific shout out to the community partners that we worked with through this project. So in Sacramento, we worked with Decarcerate Sacramento and the Community Care First Coalition. In Fresno, we worked with the Central Valley Urban Institute. In Kern and San Diego counties, we worked with the VCL Compromiso. And then finally, in Orange County, we worked with the Multi-Ethnic Collaborative of Community Agencies, or MECA. And so I saw that many of our partners are on the webinar today, so I welcome you to also chime in and share, you know, your experience through this project. And I'll pass it back to Karen for the next part of our webinar.
Great, thanks so much, Wei-Yu. So now we're going to dive into what did we hear, what did we learn, and I think a lot of this, you know, you are mostly folks who are doing the work on the ground, so it's not going to be terribly surprising to you, but I think really reinforces why we need to be taking a close look at what's happening in our counties and thinking about how we can make change there. So next slide, please. So really, from all of our research participants, both from the survey and from the listening sessions and from the key informants, when we thought about what do folks what are people asking for, what do people need, what do people want in their communities, we're sort of, thinking of it as a little bit of a pyramid of needs. And certainly the top priority was really this idea that we need to focus local investment on creating healthy community conditions, understanding this idea that where we work, live, and play has significant impacts on our health outcomes, as well as our overall wellness, our connection to each other, et cetera. And so this really included folks uplifting, the deserts that exist around things like green spaces, around healthy food access, around safe and affordable housing, and really saying that we will have the most impact when we focus on those issues, right? So that's sort of meant to be the most upstream, sort of top of the pyramid here in our little diagram. Second to that, people really thought about the healthcare system itself, and understanding that while healthcare systems are created mostly at a state and federal level, what we as people, as community residents and consumers experience is really very locally designed and locally driven. And also understanding that in California, as we're getting closer and closer to universal coverage, right, to everyone having health insurance, although we're not quite there yet, but getting very close, that does not necessarily mean that everyone has access to the healthcare that they need. And so that the real focus going forward, what we heard from folks, needs to be on this idea of access, and really access to the care that keeps us healthy in the first place, right? And understanding that most of our dollars on healthcare are not spent on primary preventive care. And I will just make a note here that when we think about primary care, and what we heard from people is that that must include behavioral health care. That is a top priority. And so we need to be thinking about a really holistic approach to primary care that includes really significant access to and significant improvement in access to behavioral health care. And second to that, sort of thinking about the healthcare system itself, folks really talked about needing to transform the healthcare workforce, and thought about this from two perspectives. One, that the opportunity to be the healthcare workforce is a really important economic opportunity for communities. It's an anti-poverty strategy, right? And really thinking about what do we need to do in order for our communities to be our own healthcare workforce. And so that includes really looking at what does it mean to be a healthcare provider? What are the real competencies there? And, looking at training and education versus lived experience, right? And how we bring those things together in a way that will also make sure that we have a healthcare workforce that's reflective of the diversity of Californians and able to meet our needs really from a cultural and linguistic perspective. So this being a really important need that all of our participants, many of our participants spoke about. And then sort of at the bottom of the triangle is this idea that because we have so many gaps, all the way from healthy community conditions to access to healthcare, because we have so many gaps, our communities are often depending on an emergency and crisis response system, and that system doesn't work for us for a number of reasons, right? And so people really said, we need to work on these upstream factors, but we also need to build a system of care that's available to us that will meet our needs in the case of emergencies, and a particularly significant focus on behavioral health crisis. And so many people speaking about their experiences, their personal experience, their experience with a friend or family member, needing that help and finding that it just doesn't exist, or on the occasion where it does exist, it's not meeting our needs, right? It's either too expensive or it's not culturally competent. So people having a lot of fear around accessing an emergency and crisis response system, and really encouraging local governments to think about their role in creating, I think, a system that is more aligned with community needs. So this is the big picture, sort of what we heard in terms of what people, the gaps that people are seeing. And now I'm going to take a few minutes to talk about the recommendations that our participants made in each of these areas. Next slide, please. So first, in this area of prioritizing investment around social determinants of health, social drivers of health, healthy communities. Again, these are very broad areas, and really want to uplift the work that many of you are doing very deeply in these areas. But I would say that the top recommendations that we heard overall across the state, and particularly in those 5 counties, one was a real focus on investment in housing, both dollars for tenant relief, and also financial support for home ownership, understanding the intergenerational impacts of home ownership and what a difference that can make. Second, really around community safety and thinking about community safety entirely differently than what we have today, right? Really with a focus on young people, on a focus on community-based programs, violence prevention, community-based violence prevention, and trauma-informed services. Third, in thinking about food access, really understanding that in many places in California, we have this incredible opportunity, and so many of our residents are very involved in growing our own food, but it doesn't stay local and we don't actually have access to it. And so really recommending investments in things like subsidized farmers markets, grocery stores, school meals that complete that loop and keep our locally grown food local. And then finally, around green space, this just, you know, when people talk about what makes them feel healthy, this real access to green space, to parks, to nature, being so important, and not just the creation, but folks really, I think, also uplifted a need to focus on maintaining these spaces that exist in some of our neighborhoods. And I think an example from one of our Kern County participants who said, when I got to the park where I usually take my daughter, the playground was burned down and melted. However, the parks in the nice areas are farther away. And so speaking to really needing to have investment and focus on those issues. Next slide, please. Okay, so, oh, I think we may have skipped over one. Oh, no, we didn't. Okay, we'll do it in this order. Perfect. Next slide. Thanks, Nafi. Thinking about the workforce elements and the desires that people had around both participating in the workforce and having healthcare providers who understand and are part of their communities. So some of the recommendations that participants had, one is really thinking about county investment in their own workers, understanding that counties employ a lot of healthcare providers and social service providers, and really ensuring, particularly for our non-licensed providers, so folks who are our community health workers, our navigators, et cetera, that we're paying a living wage, because we did hear from folks who are community health workers that they get paid so little they can't access their own health care, right? And so really wanting local investment to ensure fair wages and good jobs. Second, really developing advanced training programs, again, for these non-licensed community connected providers, so that people can really continue up this career ladder and specialize in areas where they're passionate and where they have experience. And third, really prioritizing, to the extent we are at a local and even a state level, providing financial assistance for people to pursue healthcare careers, prioritizing bilingual applicants, because that's one of the biggest gaps that people identified, is not having a provider who can speak their language. The second piece of this was really thinking about where people get their healthcare, and a desire to have our healthcare sort of be closer to our communities, right? And so building the capacity of community-based organizations, as well as continuing to strengthen our community clinic infrastructure, but so that community-based organizations are able to be healthcare providers and to employ healthcare providers with lived experience, and to serve as both health and behavioral health homes, because that's a place that people turn to. And often our CBOs are providing sort of ancillary services, navigation services, but really thinking about how do we build their capacity to be healthcare providers in our community. And one of our folks from Orange County really talked about this idea of how much it meant to them to have someone who spoke their language, understood their community when they were trying to access COVID-19 vaccines. And we thought this was important because so many of these programs have been time limited, you know, come about in a crisis, but what we really need to be doing is building that long-term infrastructure. And then finally, that there still are barriers to being, even if you go through all the training and education, there's barriers that are unjust, right, to becoming licensed or certified, including past justice involvement, and that we need to remove those to create a more equitable workforce. Next slide, please. So for the thinking about the emergency or pre-hospital response system, which again, mental health crisis response was a particular focus from our participants. One was the idea that we need to invest in the strategies we know can prevent many of these crises in the first place. And that, you know, some of that really means closing gaps so that our system is not so siloed, and really encouraging multi-sector collaboration so that when people are getting healthcare, they're also getting their social services. And in the end, we have fewer people falling through the cracks into the emergency services safety net, right? So that was sort of the first part of this. But the second part was really looking at the system itself, and a few recommendations that we heard here. One is to expand the types of providers that are part of this system to include community connected providers, and folks sort of saying, you know, it would be really helpful to me if in this response there had been a community health worker who could really understand what I was going through and also help me connect to the right services to recover and to prevent future emergencies. And part of the reason was because people felt like our current providers are not always fully trained in a couple areas. One, cultural competency, cultural humility, and both implicit and explicit biases. And so finding often that they felt discrimination from paramedics, et cetera. But also really focusing on behavioral health. We heard a lot that people felt there needed to be more training around behavioral health for our emergency response providers, and feeling like that was much more of a gap than response to physical health situations. And people also talked about really needing to better understand the system, having a system that was simple, that was really consumer friendly. And some of the top issues that people raised that need to be addressed are things around knowing how much it will cost and making sure it's not going to cost an exorbitant amount to call an ambulance or to call a mobile mental health service, and that people really avoid some of these services even when they need them because they're worried about the cost and they're worried about law enforcement involvement as another key theme. And so people saying, you know, I really needed help, but I was so worried that that the police would be a part of that response, even if I said I'm having a mental health crisis and I need a mental health provider. And that there's also, I think, a lot of stigma around reaching out for some of these. And I think also acknowledging that, you know, particular to mental health, these services just don't exist in many places and need to be built. And so one of our survey respondents said, when a family member was in mental health crisis, we had called many agencies to get in-person mobile mental health crisis support, but all they could do was call the police. Next slide, please. All right, so I'm going to go ahead and, you know, with that in mind and sort of thinking about where we want to make investment and what we heard from communities in terms of recommendations, we're going to take a sort of a quick look at what we get, or how counties actually spend their dollars. And I will say we looked at a number of counties. We're just going to highlight a couple today. So there's much more information on our website, but I'm going to turn it back over to Wei Yu for this section.
Great. So we're going to switch gear and sort of look at the technical side of the county budget and really looking at where funding came from and where funding is going. And so, you know, so not to kind of, so the easy way of thinking about local county dollars is that the biggest part for each county to make decisions is called the county general fund. And so that is essentially the main operation fund for each county to make decisions on an annual or sometimes biannual basis. And it basically accounts for all of the county's financial resources. And it's the most flexible part where, you know, there's a lot of room for advocacy. And on top of that, on top of the county general fund, the county also receives funding from other taxes and revenues, and sometimes from, you know, the state government or the federal government. And so these, you know, streams of funding sometimes have more limitations. And so, for example, one of the programs that many of you are familiar with is called the Mental Health Services Act. And so that's a proposition that's essentially collecting additional taxes from millionaires. The state government collects that and it sends money to local governments to really spend specifically on mental health and behavioral health services. And so this chart shows you there's 3 buckets of kind of research interest that, you know, the People Power for Public Health project really focused on, including mental and behavioral health, public health, and law enforcement. So this project really looks at, you know, where did funding on a local level come from to fund these 3 buckets of main or key county services, and then how much are we spending, right, on a county basis. And so as you could tell, you know, for each of these buckets, there's various sources of funding that flows into funding that, including the county general fund, and then really there's variation across, you know, the buckets. And so our research interest was really just how much are the county spending on these 3 buckets, and does it add up, right? And you could read about the in-depth analysis in our separate brief that we published as part of this project. So next slide, please. So the next slide, we're going to use 2 counties to really showcase kind of the disparity here in terms of spending. We're going to talk about Sacramento County and Orange County. So in terms of Sacramento County, I'm just going to walk you through these numbers a little bit. So in terms of the 3 buckets that we're looking at, mental health, behavioral health, public health, and the traditional law enforcement, which is the sheriff's department that the county funds on a county level, in terms of the total amount, so it says total appropriation, so that's everything added up, right? In terms of mental health and behavioral health, the Sacramento County spends 383 million, public health a little over 100 million. So if you add those 2 up, so in terms of health services, Sacramento County in its most recent budget spends about 500 million. And then if you look at the sheriff's department, that's over 600 million. And so there's definitely already difference in terms of how much Sacramento County dedicates to health services versus traditional law enforcement. And then this disparity or this difference is even larger if you just look at the allocation from the county general fund. And like I said, the general fund is where the county has the most authority or, you know, flexibility in terms of making decisions over. And you look at mental health and public health, it adds up to 50 million. And then again, sheriff's department is 320 million. So there's a huge gap in terms of how much the county is allocating its general fund towards health versus law enforcement. And then the final column shows you an average kind of per person basis. And so the county essentially, for every resident in Sacramento County, the county spends $20 towards this person's mental health and $12 towards public health and over $200 for law enforcement. So really there is a huge gap. And next slide, please. And, you know, similarly to Sacramento County, we also provided data for Orange and also Kern, which you can read about in our brief, Kern, San Diego, and Fresno. And so again, using Orange County as an example, it's the same breakdown, but if you look at the per person spending, you know, Orange County in its most recently adopted budget spends only $2 towards mental health per person, $2 towards public health, and then $72 towards law enforcement, right? And when you look at these numbers, it really shows you kind of how the county is thinking about what's important. And there's essentially that like, you know, spending is very different from, you know, when we were talking about earlier, you know, what do our communities want, right? There's a huge gap in terms of what the communities want and what the counties are spending towards. And so I'm not going to go too much into details, but I'm going to pass it back to Karen to talk about, you know, what do we need to do in terms of this gap?
Great, thanks, Wei Yu. And again, really encourage you to check out the other counties in the brief that's been dropped in the chat and available on our website if you're interested to see. They're all pretty similar in terms of the headline here, but if you're interested to see those local counties. So again, I think the most important part of this is how do we change the equation and where do we go from here, and understanding that nothing is going to change unless we build the power to change it, right? Unless we really build that community power. So next slide, please. So no surprise, we asked people in this project, are you interested in being part of changing local policies? Do you want to be, do you want to have an active role? And overwhelmingly, yes, people do, right? Our community members really want to be part of this process. They want their voices to be heard. They want to be able to advocate for the issues that are important to them. And in order to do that, folks asked for training and guidance on the policy process, as well as local budgeting. But I think even more importantly, folks really thought about how the system needs to change and meet us where we're at, right? It's not only that we need to learn how the system works, but the system needs to work differently and really empower, engage, listen to communities and what our needs are. But again, we all, I think, understand that systems are not going to change on their own, right? And so one of our Kern County residents said, I think we have to get more involved as a neighborhood and participate more in decisions, because sadly, it's a handful of people that decide where these resources go. And in this, there's so many local groups that we worked with that are really leading the way on this. Our friends in Sacramento, Decarcerate and Care First Sacramento, who have really been active in the budget, our friends in San Diego and Kern and Orange and Fresno, really so many examples across the state. And today we're just going to highlight one with one of our guest speakers. And so if we can go to the next slide, please. So we're really fortunate to connect with the Contra Costa Budget Justice Coalition through this project. And we have Dan Geiger here with us today, who's the coordinator for this coalition. And we were, I think, particularly inspired by their work because they brought together a really broad-based coalition with specific sort of understanding and lens around racial justice, and really thought about this sort of power building all the way from how do we build the knowledge and capacity of our communities, how do we identify the needs, and then what are the policy levers we really have to make change, including a countywide ballot measure that they have worked on. And so I would like now to welcome Dan from the Contra Costa Budget Justice Coalition and turn it over to Dan to share sort of who they are, what they did, and what they learned. So Dan, take it away.
Thank you, Kieran, and everyone at CPEN for having this webinar and inviting me here. Next slide, please. I'm going to try to go through this fairly quickly so we can have some time for questions and discussion. So quickly, I'm just going to kind of give a picture of who we are, what we do, what have been our goals and strategies, some highlights and history, and then where we're looking at going in the coming year. So next slide, please. Yeah, I think Kieran already kind of highlighted our mission, but we're really all about community engagement and a values-based budgeting principles, all with a lens towards equity and serving those who are most in need. So next slide. This is actually a very important slide, because if you just can kind of glance through the list of organizations in this, it's a broad coalition that includes human service organizations, but also kind of grassroots organizing advocates and labor. And there's an important element about the labor involvement that'll come up later when I talk about the things that we've been doing. So we have about 35 members now, organizational, and plus a lot of just individual residents. So our active mailing list is around 80 people. Next slide. So what we do, we educate people about the budget. We have a lot of workshops and really help people understand what it is. We do a lot of analysis when budgets come out. And then we mobilize people, we identify priorities with our members and other partners, and then we activate people to, meet with the Board of Supervisors, meet with the Chief Administrative Officer, show up at board meetings, and do a lot of advocacy. So that's essentially what our work is. Next slide, please. And what are basically our high-level goals is to change the culture. I think several things that were mentioned in the previous presentation talked about people just don't know what's going on and they're not engaged and who's making these decisions. So that's very much the culture, I think, in Contra Costa, but I think it's true probably across the board in most counties. And to kind of establish a way that the decision makers apply a values-based lens and equity-based lens to the budgeting process and decision making. and to increase transparency and community engagement and to educate people. So, these goals are very, very consistent with what Kieran was just talking about. So, our strategies are we build this coalition. It's very broad. As I mentioned, a lot of research and analysis. We really strive to hold the county accountable on a lot of decisions they're making and develop proposals on process as well as other things, and educate people. And we've gotten to the point where we have very good relationships with the Board of Supervisors, the Chief Administrative Officer, and her office. And that's a very important thing, by the way. A lot of decisions are made at a county level by the Chief Administrative Officer, or whatever the title might be in your county. And what we've experienced is more often than not, the board kind of defers to their recommendations. So that's a very critical piece of this whole thing. We do a lot of advocacy on particular issues, and we mobilize folks. So next slide, please. So I'm going to give a little history because I think it's interesting and illustrative, and it might be useful for you all. We got started in very late, right, like December 2017. There was a group of us just kind of sitting around basically complaining about the budget and how does this work and why do they do this, and we just don't even understand any of it. And we heard about a group in San Francisco called the Budget Justice Coalition. And so we said, wow, that's what we need. And we kind of got together, and literally a month later, we sent out a survey through all of our networks asking about the budget. What do you know? What's your priorities and such? And within 48 hours, we got over 400 responses, and we were kind of blown away. It just sort of told us like, wow, we have struck a nerve. And so we launched ourselves in January, and we kind of announced ourselves at the Board of Supervisors has an annual budget retreat in the last week of January. So we announced ourselves, and then when we were getting going, basically we realized like, we don't understand what we're doing. We don't understand the budget. So we hired somebody to come in and do some workshops and training, and we invited guest speakers from the county. We did a lot of research on budgeting and budgeting models in various places. We developed some proposals around process, and we started advocating on issues. And then 2019, we began doing like broader town halls. We would invite the members of the Board of Supervisors to join us in their districts to educate people about the budget. We continued to advocate on process and issues. And we began to, and this is where the labor equation comes in important. We began to talk, so many things that we worked on was always ended with, well, we just don't have enough money. And the supervisor said that, and a lot of people said that. And sometimes that's a way of like saying no to what people are asking for. And sometimes, there's truth to that. So we started talking with folks about a sales tax measure, and that emerged to become a coalition with labor and, very similar to our coalition, but also allied with some supervisors. And in 2020, we went through a whole process, formed a work group. And as was previously mentioned, we got a measure on the ballot in 2020. It's a 0.5-cent sales tax available to spend technically on anything, but it's called Measure X, and it's generating actually about $110 million a year, which is great. So, excuse me. Labor was a major leader in that effort and also a funder of the campaign. So that's one reason why I'm kind of point that out several times. Then, of course, 2020 hit, and oh my God, everything hit, right? The COVID hit, and there was so much going on around COVID funding. There was CARES Act money coming from the federal government. The sales tax measure was on the ballot. The racial justice uprising really brought that issue to the fore in 2020. And in the summer, we did a great deal of advocacy and analysis on like the sheriff's budget. And they were getting some money from the CARES Act, and there was a huge advocacy effort on that. We had like, I think over 100 people come to a board meeting. The meeting went to like 9 or 10 o'clock at night, advocating around that issue. That was in like in August. We did a presentation to the Board of Supervisors with some other folks about racial equity and the need for an Office of Racial Equity and Social Justice. Many others were working on that as well. So 2020 was just a deluge of all kinds of activity, right? And then what happened in the fall of 2020 is Measure X passed. So in 2021, part of the measure included an aspect to create a Measure X advisory board. And so we weren't directly involved with that, but the county kind of shepherded that process, and it ended up having great representation from all parts of the county and many different areas of potential funding, mental health, homeless, I mean, you name it, all and the sheriff, fire department, everything went through a very rigorous 6-month process to provide recommendations to the board about how to spend that $110 million per year. And when that was happening, we all kind of realized, like, wow, this is what we were thinking about when we first got started, like, 2017, like an active, engaged community providing input into the budgeting process. Now, so we did several of the recommendations of that board were funded, several were not. Some things that board was opposed to were funded. So it was, there was some success, but it was a mixed bag. There was some frustration, but, in a way, that's kind of the way these things go. Out of the racial justice uprising, a new group formed called Reimagine Public Safety. And we are an active member of that, kind of basically providing budget analysis. So when there were kind of advocacy around the sheriff's budget, for example, we would put together data, like historical data of like, what's the sheriff's budget, craft against the rate of crime. And actually what you can see is the sheriff's budget goes up and crime goes down, basically, right? Similarly for incarceration and that sort of thing. So we do a lot of, we're kind of like, quote unquote, the budget people, right? When people are talking about these issues. And, we worked with the Bay Area Equity Atlas, which is a great resource. There's a national equity atlas too. They get a lot of data about equity measures on a whole bunch of different variables. And then in 2022, when this year, we did an equity presentation to the board at their board annual retreat. That's the first time any outside party like us has been invited to present to the board. We do town halls with department heads, in particular health department and human services. ARPA has been a big area of focus, and frankly, it's been a rather frustrating effort. In Contra Costa, pretty much all the ARPA money thus far has gone to the health department for quote unquote COVID-related health expenses. Now, one thing that's different in Contra Costa is Contra Costa has a hospital and a health system and a whole system of clinics. So Contra Costa's budget is pretty different than a lot of other counties. So there are a variety of issues there. And we'll get into it. I'll talk about the Office of Racial Equity and Social Justice as we look at moving forward. And we started also, there's some supervisor seats that are up for election. So for the first time, we kind of did like a questionnaire for candidates to like, hey, what do you think about, well, what's your opinion about these various issues in regard to the budget? So that's been the trajectory. And, through all that, we're definitely like, everybody knows us, we're on the agenda many times. And we often don't get what we're advocating for, but we are in the game. So next slide, please. So now we just kind of finishing our planning for the coming year. And if you can go to the next slide. Essentially what's emerged is we've been looking at a variety of things, and we kind of came up with this 3-pronged strategy. One is to really push for embedding equity principles in departmental budgeting, because that's where a lot of the action is. And we've learned from other counties, like Marin County, for example, and actually there are many counties around the country that do that, and they have tools that they use to actually apply an equity lens to department budgeting issues. We also are planning on working with our Office of Racial Equity and Social Justice to do a participatory budgeting process. That's basically, I'll explain a little bit what that is, but it's basically we're going to ask for money from ARPA funds for like a pilot and have a community-based process that actually decides the money as opposed to advises the board, as had happened with the Measure X. And then that would lead, all of which could lead to momentum around a people's budget. And all of this is supported by our ongoing work, that happens throughout the year. So next slide, please. So just quickly, what is participatory budgeting? And there's actually a great organization called Participatory Budgeting, I think Institute or something. If you Google it, you'll find it. And they've kind of been doing this for some time. It's been happening in many, many places around the country. But it's about giving community members actual money and having them go through a process to decide how to spend it. The next slide, please. So you can see part of some of the benefits here. A big benefit is actually it increases civic engagement and it educates people about the budget, which Karen and others were talking about earlier. So this is sort of an interesting means to do that. Now, like in Contra Costa, there's a $4 billion budget. And if we get 5 million, it, in a way, it's a drop in the bucket, but it has the benefit of really engaging communities. Next slide. And then the other thing we want to start working towards is a larger effort around a people's budget. And next slide, please. That which would address the whole budget, right? So it's basically, I think it's really kind of a political strategy to put a set of priorities on the table that contrast with what might be happening in your county or city. And so I think it's really a civic engagement and kind of political organizing tool. So next slide, please. And we've looked at various ones around, there are various of these efforts happening, I know in Sacramento and LA and elsewhere. What we were very interested in is one we found in Oakland. And in particular, this is a big project to try to do something like this. And, you know, we kind of feel like, you know, if we do this, we want to do it right. So we think what we're going to do this year is maybe start small and at least like this is what you're looking at here is from the website of the Oakland People's Budget. And they basically put a thing up here where you can say, okay, Oakland's budget is 45.99% goes to the police. What would be your allocation? So it's a tool, interactive tool that can then generate something and say, hey, this is what you're spending. Here's what the community, you know, believes you should be spending on. So we're going to work towards that. Maybe just start with this website, webpage kind of survey tool to start kind of having that larger conversation about the entire budget. So I am looking at the time. I want to wrap up and leave time for discussions. There are many, many kind of lessons and things we've learned. This stuff is hard. A lot of county money is already predetermined. So I mean, sometimes that's used as a reason not to do what people want. And sometimes there's also truth to that. So you have to kind of really focus on what money is on the table. And that's the general fund. And there is even some portions of the general fund that are more on the table than other things. Other things, I know a lot of folks are interested in, you know, looking at sheriff's budgets, for example, vis-a-vis health. One thing is probably true in your county, you know, the sheriff is an elected officer and basically does his own budget. So the board decides how much to give him, but what he spends it on is really up to him. And also they're very powerful. You know, the sheriff is very powerful and the union is very powerful. The sheriff's union is very powerful. And what we're seeing today, which probably many of you are seeing with the backlash, you know, the fear of crime and such, that's politically, you know, a very powerful factor in our county and probably in most counties. So that's I think that's not news to any of you, but that's definitely a factor here. So that's basically the story. And let me stop so we can have a little time for Q&A comments.
Thanks so much, Dan. So we invite folks to ask questions in a couple of different ways. You can either put your question in the chat and we can read it out loud for our speakers to respond, or you can raise your hand using the Zoom function and we can ask you to unmute. And if we can take down the slides maybe so we can see folks' faces. So we can see who might have a question. So.
While folks are thinking of their questions, I do have one question for Dan, and thanks so much, Dan. I think it was really, looking at your timeline made me realize like how just dogged we have to be about this work, right? And that it really takes sort of that long-term building, and I'm super impressed by the coalition and just wondering when you put together a broad-based coalition like that, it seems like people would have a lot of different ideas about what we need to spend money on. And so I'm just curious, in terms of putting together a coalition, how you all have been able to sort of come to shared priorities and an advocacy strategy that everybody's behind.
Yeah, that's a really good question. So a couple things. So in the beginning and throughout, we have to be very clear that, many of our members have their own particular interests, which is great, right? That's what they should be doing. But our focus is on just the general level of principles and values and process. So we will at times, advocate for a particular issue or proposal, but it's not because, it's going to benefit one of our members. It's because it's the right thing for the community. And so we all have to kind of also come to an understanding, like we might sometimes have interests that conflict. If there's a pot of money and 5 different groups want it, we're going to have to agree to disagree sometimes. And frankly, at times that's been most important with labor, because there's often sort of perceived, not always real, but perceived conflict, because labor, they're negotiating, they want more money for their members and so on, and that's great. But then the community organizations also want money, and there's like kind of this history of, potential conflict. So we just had to like, you know what? We share the same values, the same priorities. We're going to disagree sometime, but that's okay. We'll be respectful to one another and work together. And that Measure X campaign was something that was so good because by virtue of working together, we developed really great relationships and trust. So we haven't really had problems, but that is an important issue. So that's a really, really good question. It came up early and several times along the way. And by the way, one thing that was very interesting, our membership grew a lot when the racial justice uprising happened. And we did a presentation to the Board of Supervisors about equity issues and proposing an Office of Racial Equity. And apparently a lot of people were watching that meeting on Zoom. All of a sudden our membership just like, boom, a lot of people joined up after that. So that was very interesting.
Thanks so much, Dan. We have a question here as well. Dan, you mentioned there's some opportunities around the Federal American Rescue Plan Act dollars. Can you and also Wei Yu share a little bit more about that opportunity?
Yeah, and what I've learned is that it's really different in different counties all over the place in California and elsewhere. And as I mentioned in Contra Costa, all of it has gone to the health department for medical expenses. And it's about the only county that I can find that that's true for. And I've asked many, many times, why is that the case? But other counties, like for example, in Marin County, we met with them a couple of weeks ago and they formed an Office of Racial Equity. And they got, I don't remember, I think $2 or $5 million out of ARPA money to fund a participatory budgeting process. So that was partly our inspiration to kind of adopt that strategy. Other counties have done, Ventura County has done a really interesting process soliciting community input. Los Angeles, if you look for the Los Angeles CEO ARPA page, it's probably the gold standard of a county that did great work about engaging the community on ARPA and really having very explicit equity guidelines on ARPA. So there is money in play there. You do have to keep in mind it's one-time money though. So if you try to fund a program that's going to require money year after year after year, you got to figure that out.
Yeah, thanks, Dan. And I love that when you were talking about the opportunities that ARPA presents, you talked about having part of that really be like piloting participatory budgeting for, Contra Costa, right? And like, I think that's really the opportunity we're hoping more counties would seize, is that it is a one-time funding, but it is a lot of money and it's unprecedented flexible dollars that local governments are receiving with very little strings attached, right? And so really, this is like high time for counties to, implement a different way of making budget instead of just having that decision-making rest with a few number of the powerful people in the county. Really open that process up, right? And there's a variety of ways that counties can do that, from the traditional way of decision-making to actually reaching participatory budget making, or even the people's budget, right? Like you were saying,
Yeah.
and like there's so many ways that they can try out to experiment with like sharing that decision making power and really listening to what communities want. And just as a plug, CPEN, we have done some research and evaluation on how counties in California are spending their ARPA processes, and so we rated them and we kind of gave them grades like as if they were like school kids that are trying to like complete this project. And so the folks can really check out this work that we're doing in parallel to our People Power for Public Health project, which is looking at general budget making. But there is a lot of opportunities, and advocates can really try to like advocate in both processes that their local governments are doing. But thank you for highlighting that, Dan. That's really crucial.
Yeah, very, very excellent. That's why we're sort of thinking of this participatory budget. It's in a way, it's leverage to build towards the larger, like if people can learn about it through that, then we can apply all those things to like the overall budget, hopefully.
Thanks so much, Dan and Wei Yu. And I know we're nearing the end of the webinar, so do want to pose one last question. Do you all have one piece of advice for others who want to do similar work in their own counties?
I guess the first step would be, talk to other folks, and not just folks that are in your space, not just advocacy, not just human service, but bring together like a core group to kind of talk and think this through and understand what's happening in your community. And, that I think was the key from us in the beginning. It kind of had to happen randomly in a way. It just happened to be a group of us sitting around the table. And but then we kind of realized like, no, this is different than other types of organizations. It's not just advocacy, it's human service, it's everything. And I guess that's sort of the main thing. And there's a lot to learn. It's hard. We've worked a lot and we have had some victories, but we've, many, many times we're asking for things that we don't get. So we have to kind of reflect on like, hey, we're making a difference. We're on the agenda. People are talking about it. But it's a very, very entrenched process. And the decisions are made like behind doors that you don't have access to. And it's very, very ingrained. And typically many boards of supervisors, they may or may not even understand like what's actually going on. They just kind of like, okay, we're going to do what we did last year and maybe tweak a little bit around the edges. So you're going against a pretty entrenched system. So just understand that and be prepared for the long haul.
Thanks so much, Dan. I think that really sets folks up well to sort of think about how they might get started and what they should expect in engaging in this work. So really appreciate that. I want to thank you, Dan, for joining us and for sharing the experience of Contra Costa. I'm really looking forward to continuing to work with you all there and learning from you. And want to really thank everyone for joining us today. And if you have sort of follow-up questions, you're welcome to reach out to us. We'll put our contact in the chat, as well as if you want to get involved and you're sort of saying like, hey, I want to look at this in my county. What resources do you have to help me? We will be, happy to try to support that. And I also want to give a big thanks finally to our CPEN team here, our staff team. You've met a couple of them, but there's so many other people behind this work, current and former staff. So big thanks to our CPEN staff team. I hope everyone has an excellent day. We really look forward to continuing this work together. Thank you.